Good morning, everyone, and welcome. Thank you for joining us today for the 2021 Lancaster Learns Online Conference. This is our 7th year of operating a local teaching and learning conference for the higher education community in the greater Lancaster County area. We are glad to be able to continue the tradition, although we are virtual this year. I am Michael Shelley, Educational Technology Analyst at EMU Lancaster, which is one of the sponsoring institutions for this event. We are always ready to welcome other local colleges and universities to our group. So if your institution isn't currently a sponsor, please reach out to us via email at info@lancasterlearns.com for information on how to become involved. This session is being recorded. Links to the sessions recorded today will be made available after the event. Attendees will receive an evaluation survey email that will include details on how to access the session recordings. Recordings may take a few days to process and centralize, and potentially a minor bit of editing. We are using the Zoom webinar today for the presentation. Webinar format does not permit your microphone or video to be turned on. The webinar does have a Q&A function, which is located at the bottom center of your screen. Questions will not be answered until Dr. Banerjee's presentation is completed. If you need assistance during the seminar, I will monitor the chat during the presentation and do my best to assist you. Now, our session is titled Online Classroom Engagement Amidst Fears in the Pandemic Era. And our presentation will be done by Dr. Shrees Banerjee of Walden University. Dr. Banerjee has nearly 20 years of experience in the areas of public health and global health. He has worked at the Centers for Disease Control in the area of infectious diseases and has worked on public health projects worldwide. He has published COVID-19 related research and was instrumental in starting the contact tracing program in Pennsylvania by creating one of the first state training programs. He's also co-authored and published more than 50 research articles in prestigious journals such as The Lancet and the Journal of American Medical Association, with emphasis on global health, social epidemiology, cancer, and injury prevention. More recently, his research has received widespread attention from prominent media outlets such as Yahoo News, Healthline, Health Digest, and MSN Health News. He uses his medical clinical expertise and his research acumen to guide his students. Again, I would like to remind you that if you have questions, please put them in the Q&A, and Dr. Banerjee will monitor that at the end and answer questions at the end of the session. Dr. Banerjee, you are free to begin your presentation.
Michael, thank you for that wonderful introduction, and thank you for having me in this year's session of Lancaster Learns. This is a really great honor for me to be here to be able to present some of the research findings and provide you some insights from the experiences that I've had in teaching. Virtually and some, in person, but mainly virtually, and how this virtual experience is actually influenced by some of the COVID-19 related worries that students are having. So thank you for having me, and we're going to have in the next about 45 minutes, we're going to go over some of this original research I've conducted, build on some of the concepts related to anxiety, related to worries, and by identifying and understanding some of the anxiety that our students face, to be able to cultivate some strategies. And my job here today is to present to you a lot of these sources of anxiety so that and provide you with some strategies so that you can use your skills uniquely to present this in an online environment for your students. So I hope I leave you with some tangible, some concrete tools rather than just talking about theory. So let's get started here. As Michael said, I have a clinical background in medicine, so not only am I going to use my pedagogical, professor skills, I'll present to you some clinical practical skills to deal with anxiety. Okay, so let's go ahead and get started. So again, like I said, different models to understand anxiety, distinguish between the different types of anxiety, and then once we understand this in the unique perspective and context of students, we'll be able to devise and provide strategies on how to cope with a lot of these anxieties and worries. So let's start broad, okay? Let's start talking about, why I called this, at the title, I said pandemic era. And I've been doing COVID-related research and following in different contexts how COVID is, affecting and evolving. And, even most, I'll give you an example, even recently, there have been so many changes in terms of which vaccine is appropriate to handle, which one is not, which is effective against different variants. So there's so many worries. There's uncertainty. So the reason this is a pandemic era is because if you look in the last about 20 years, 2002, there was SARS, and then, 2009, you had the H1N1 pandemic, and then 2012 MERS, 2014 Ebola. So it seems like that the new norm is that every 2 to 3 years, there's some sort of potential for pandemics. So now more than ever, it is imperative that we devise a strategy that we can not only employ during this pandemic, but any and all future pandemics. The more we understand the anxieties that are coming out of it, the more we can help our students and tailor these things. In our classrooms, we have so many students, right? I mean, it's almost difficult to be there, individually, but how do we devise strategies to try to have targeted interventions where students can feel more comfortable? So that's what I'll be going over a little bit more. But let's also talk about now the physiological definition of anxiety, because like I said, I'm a person that is clinically trained. So I have to understand, when I'm understanding anxiety, I have to understand what are the symptoms. What is it exactly that my students are facing? So what is it? Intense, excessive, and persistent worry and fear about everyday situations. So symptoms, okay, fast heart rate, rapid breathing, sweating, feeling tired. So some of these symptoms, if you look at these symptoms, some of these symptoms can feel very similar to what individuals experience in COVID-19. So imagine trying to, having these worries already, and then on top of that, individuals facing potential infection from COVID-19. So that just makes a lot of these symptoms much worse. So think for a moment here. Let's take a pause here and think for a moment. Think about one student. Let's not think about the whole class. Think about one student that you've been facing, that you've been that has been going through a lot of difficulties. Think about one student, and think about now that you know the symptoms of anxiety. How is that making your student feel? I mean, they are at the same time, simultaneously, individuals that I teach, they have, obligations at work, they have obligations with family, they have children that they have to tend to. So there are so many things factored in. So how is all of this affecting your student? And if I can get some comments, I would appreciate that. Maybe type in the chat box. If you can think about that. Okay, I'm getting some. Cynthia said panic attacks are common. Okay, yeah, good. And then Danielle says poor time management. Very good. So, and to be able to have fast heartbeat, to be sweating, you know, you're not able to concentrate on your tasks that are at hand, deadlines that are at hand. It's so much easier to miss when you're anxious and when you're worried. So changing priorities, schoolwork seems less important. Good, Marie. Yeah, that's very important. So Francesca's saying, you know, fear that keeps them from being present. So feeling detached, feeling like, you know, you're not quite all present in your mind, in cognition, affecting understanding, learning. All of these processes are hindered when you have additional anxiety. Sheila making the point that many extra layers of daily decision making, right? And we're going to go over a decision tree about differentiating between real worries versus ones that are, you know, that are not necessarily, that are a bit more exaggerated than what you feel. And so there's definitely a lot more decision making going on. So that will definitely hinder in your ability to concentrate, focus, and eventually learn new concepts. So very, very important contributions that you've given. I really like to ask these questions because every time there's unique ideas that come out of the audience. So thank you for participating. Okay, so you know, if you look at these pictures, you know, part of being cognizant on whether you're teaching remote or virtual is, you know, in remote you get to see the Zoom pictures and seeing faces, and that's all you could rely on when you're teaching virtually is when you're seeing their face maybe on Zoom. So if you're able to look at the face and be able to tell kind of what is going on with the person, maybe you can have a higher index of suspicion, and you can kind of reach out to the students that are having difficulties, that are, for instance, time management was something that Danielle brought up. So if they're having difficulties with deadlines, time management, you can identify these individuals. I mean, this is something that would be common during normal times as well, but especially during pandemic times, you want to be sure to reach out and see when you have warning signs, you know. And so sometimes the only way that we're able to do that is by, you know, kind of gauging by looking at their face on Zoom. And if you're seeing that they're withdrawn, or as you see in the picture on the left, there's, you know, something that may be going on that may be hindering them from doing their assignments, that might be an important way to reach out to connect with students and deal with excessive anxiety during pandemic. So that's one strategy right there. So I'm going to also go over, you know, a little bit about this case study. And, you know, this is something that is the point that I'm trying to make in this case study is that this is not only unique to, you know, local colleges or a Lancaster thing or a Pennsylvania thing. This is something that is being experienced nationally, even in Ivy League schools, even in places. So, and this is something that is anxiety is a part of any student culture. And so sometimes the culture of you know, graduate students, for instance, there's a toxic culture. So there's a lot of overwork and not enough understanding of mental health issues. And so 1/3, you know, this is very important. 1/3 of the students felt neutral or dissatisfied with their mental health. So that is an alarming number of people. So, you know, this is a general kind of overview, but let's dive deeper into this. So another standard, and I'm going to be showing you anxiety from different angles, different perspectives. So this is, I'm still building my case of understanding anxiety, specifically in the context of students. So Diagnosis and Statistics Manual, DSM-5, for those of you that are, familiar with mental health, this is a very important criteria. And so it had, these individuals, excessive anxiety and worry, apprehensive expectation. So if this is occurring more days than not for at least 6 months, then, and if it's affecting school performance, then this is more definition of anxiety. And you differentiate between generalized anxiety disorder versus others that are more temporary. So the individual is finding it difficult to control the worry. And I'm going to go deeper into understanding the concept of worry, but just hold that thought in the back of your head, and I'll revisit this later. So the anxiety and worry are associated with 3 or more of the following 6 symptoms. So, this is what is kind of the general approach. So now that you have a kind of a good understanding of anxiety in the context of students, what are the physiological effects, let's transition into talking about kind of an original, study collection where some students were asked some questions about anxiety. But before I do that, let me go over some demographics of these individuals. So you can see the distribution. This first slide is about the distribution of the respondents that I'm going to present more information on. So here we've established that about half of the individuals have some college education, but some of them are high school graduates, and then some of them are college graduate or higher. Age distribution is pretty reasonable. However, this was the 48% were between the ages of 18 to 24. So let's take a look a little bit more about the demographic information. More females than males, so that can be a little bit more. The sample might be a little bit biased because of that, but we can control for that in multiple regression models. Anyway, so here's the ethnicity distribution of the research I'm about to present. Okay, so there were quite a few questions, but the main question here is that, I'm worried about catching the virus. So keep in mind here, the students, they're already facing difficulties in terms of balancing school, balance with work and family already. These are everyday concerns and worries that are present. Now, there's this additional worry that they might catch the virus. So, there's this percentage, about a quarter, that said, they're not at all. But aside from that quarter, everyone else is, quite worried. And some worry, I'm going to give you a worry continuum. Some worry is actually beneficial because then it allows you to take the precautions that you need in order to stop you from getting the infection. However, if it's excessive, so for instance, the individuals that are worrisome more so is individuals that are extremely worried, right? So that can be actually causing distress rather than eustress, if you think about it in that way. So very extremely, all of this quarter is what is what causes more anxiety. Okay, so let's clear this out. And then I'm going to present a little bit more about this in future slides, but I don't want to bore you with number after number after number. So I'm going to take a little bit of a break and talk a little bit more about kind of the simple understanding, of anxiety, not so much the clinical portion, which I was going over, but kind of understanding that anxiety, especially anticipatory anxiety, this is what is to be focused on in terms of COVID-19. The anticipatory anxiety is what makes it more difficult. So the uncertainty, and with that uncertainty, more importantly, what does that result in? Well, it's a perceived loss of control over your life. And that's where some of that anxiety starts to take over. So anticipation of long-term health impact, particularly anxiety on youth due to COVID-19 related restrictions. So it's not only just worried about contracting the illness, like that one question that I asked in the survey, but also worries about isolation due to quarantine restrictions, impact on social determinants of health, and then impact on typical developmental trajectory. So let's take a little bit more, let's explore this topic of anxiety and look at other reasons why there might be anxiety, right? So of course, the initial anxiety of catching the virus, that's there, but there's also equity to talk about. So the disproportionate distribution of power and privilege within society, which is so prominent and so important to acknowledge, exists. And so COVID-19 has disproportionately disrupted the safety and stability of communities of color relative to white communities. So, businesses have been affected much more in communities of color. Disproportionate rates of unemployment. Blacks, Hispanics, they have about a quarter, 24-25% have experienced unemployment versus in whites, which is 16%. So, even renters. So you can see in all walks of life, housing insecurity, in terms of businesses being affected, this is disproportionately affecting communities of color. So how does that cause anxiety? I mean, you can make the argument that, it's really not causing anxiety, but it does, objective risks are different for different communities. So it's when you're talking about COVID-19, anxiety in students, the context is extremely important. So in terms of, certain mental health consequences may affect youth and affect students a lot more. Okay, so that's another source of anxiety. This is now a model, which I was kind of talking to you about before, where there's normal worry and there's eustress versus distress. So normal worry, a little bit of adrenaline that allows you to focus and concentrate. For instance, right now I have a little bit of adrenaline, a little bit of, little bit of presentation anxiety, but it's allowing me to focus and concentrate. But when you have excessive worry, that's when it starts getting in the way of living life, poor performance results in school, in classes. It allows you, it makes you feel demoralized. So, that's when priorities start to change. And so Marie brought that up. And so schoolwork is no longer as important. So, that was a very good observation. So now that I have, presented a couple more perspectives, you saw anxiety presented from this worry continuum perspective. You saw anxiety being presented from the equity perspective, and also talking about, some of the research. Now we'll go back into the research and explore this a little bit more and see what are some other worries that our students have. Okay. So here's another worry. I am worried that basic hygiene is not enough to keep me safe. So from the virus. So, again, the colors to be watchful about is, extremely and very, right? So what I'm gonna do is mark that for your convenience so that you can see that. Okay, so Sometimes this draw tool doesn't want to cooperate, but right here is where we moderately, that's something, but definitely very and extremely is something you want to pay attention. So green and purple, right? And potentially some of this. So again, another worry, our strategies, our mitigation efforts for COVID-19 is not enough. That worry is enough to change focuses, change your priorities and not be able to focus on school. Okay, so let me clear that and then let's go on to the next slide. So again, family safety, very important. We have a socio-ecological model, which I will go over a little bit, but individual and then interpersonal is just as important as individual. So interpersonal, family, all of these things people need to feel that they're safe. So again, let's focus on purple and green. So if you notice, the percentage for that wasn't for hand washing was not as significant as for keeping families safe. This is a very important worry, even more so than fear of personal safety. Keep that in mind, because now you're seeing that these anxieties are compounded on anxieties, making all of this even more difficult to deal with. Okay. So these are real worries that our students are facing. Okay. So this is a chi-square that I ran, and bivariate analysis. I haven't gotten into the bivariate analysis yet, but if you see here, what I wanted to point out here, it almost seems like the worries and the anxiety increase with more education. And so if you look in individuals that have a college diploma, you'll see that in this category, 36% were worried and 11% were not worried. However, those with a high school diploma, only 19% were worried, whereas 24% were not worried. So, this is something to keep in mind. Again, distinctions being made, what level you're teaching in, and maybe there's more education needed at the community college level versus individuals that are teaching college versus individuals teaching at the graduate level, master's and PhD. So this can be informative at that level. Okay, let's keep moving forward here. So this next slide comes from a paper that I worked on last year with public health experts and counselors that are in the field and psychologists. We collaborated together and came up with a model and some research. And I think this is very useful in informing and presenting how, as a society, we're experiencing anxiety. So this is a pretty complex sort of model, so I'm not going to really explain every single part of this. However, I'm going to highlight some parts here and show you. So this is behaviors that are beneficial, and these are maladaptive sort of behaviors. So this is a good way to kind of understand what is going on quickly. And so this is all of the social distancing sort of mandates that were put in place initially. And some of them are in place still, some of them are not, depending on the place that people reside in, because different states started, doing different had different policies to mitigate COVID-19. So here, social adjustment and social nearing, these individuals are feeling cohesive, and so that results in lower mortality, even better health outcomes. So they feel connected, and it's kind of a vicious cycle. If they feel connected, that's good. However, when there's inequities in society, which I presented to you about, or for whatever reason, they're going through a lot more stress in their lives, and a lot of individuals that go through community colleges and whatnot, a lot of their financial situations are not necessarily conducive to paying tuition and things like that. So there's a lot of concerns, a lot of worries. So a lot of those worries can lead to social isolation, loneliness, and lead to more social strife, not feeling that they belong, that they're part of the community, and this can lead to negative consequences. So this is, again, a vicious cycle down here. Okay. Let me go ahead and clear this out, and then we'll look at another model here. Okay, so before I go over that, let me go over this anxiety from a learning model. So this is from my work with another author in 2018, which was published in the Health Education Journal. And now it's actually in circulation and people cite it and everything. But I wanted to present this to you. And there's this basic concept of cognitive dissonance. So when you're thinking of students in general and the anxiety that they're facing, a lot of times they're making career changes. They're going through this this identity formation, right? They're trying to create an identity for themselves by changing careers or changing paths. But in this, there also is phases of role confusion. And this was part of Erik Erikson's research. And so in that role confusion, there's cognitive dissonance that takes place. Now, what happens is cognitive dissonance. The student's worldview, they come in with a certain worldview, certain paradigm, a way to look at the world. And so when they learn new concepts, that challenges their existing worldview and paradigm, causing kind of a phase of disequilibration or cognitive dissonance. So that allows, this is not necessarily a time of worry and anxiety, but this is an opportunity to learn new concepts. So the point that I'm trying to make here is that a little bit of anxiety, a little bit of worry actually can push the student to learn new concepts. But if that's too excessive, then that's where there's not learning anymore. Then that's just worry. So this is a learning model, and you can understand it, where anxiety comes from here. So now what I'll do is I'll provide you another perspective. This is from leadership research that I conducted from a grant, and understand anxiety from that perspective. So leadership, one of the things that I studied is how global mindset is connected to leading others. So as expected, global mindset was connected to leading others. And this is actually a regression model that I ran. However, myself and another principal investigator, when we were looking at change adaptability, we actually found something surprising. So our initial hunch was that change adaptability will actually allow individuals to lead others more effectively. However, we found that individuals that have more stability and actually rely more on resilience rather than adapting to change, those that are focusing on more stability and resilience do better in leadership. So, okay, that's in leadership, right? So how does that apply to students? Well, this can be kind of inferred and extrapolated into students by understanding that change adaptability is not always a positive thing. Sometimes having familiar things in the classroom environment, having things that they feel like they're accustomed to it, having kind of uniformity within the classroom. If the announcements go in one place, in other classes, then you want to keep that the same way. That familiarity, believe it or not, alleviates anxiety. So that's another strategy that you can use to keep maintain to address anxiety. So this goes a little bit more into that, and I'm not going to go over every single slide from this, but that was the highlight of that research. So let's explore a little bit more about specific fears. And you have a general overview of anxiety. You have all of these perspectives from leadership research. You have perspectives from psychology, from public health. Now let's talk about what are some of the fears that are so typical. So danger and contamination fears, of course, that's there. Fears about economic consequences, xenophobia. So some of these questions that were there is that, do they feel that foreigners, carry the virus more? If this is this is an unrealistic fear, but it's a fear of foreigners. Compulsive checking and reassurance seeking, and traumatic stress symptoms about COVID-19. So these are all the fears that are assessed in the COVID stress scale. So you've heard me talk about anxiety ad nauseum from different perspectives, different models, defining anxiety, understanding it. Now let's talk about some practical things that you can do, solutions in your classroom that can help alleviate some of this anxiety. So building a relationship of trust with students is extremely important. Whenever you see for students having difficulties, whether it was through a Zoom evaluation of a Zoom kind of video that you saw, or maybe you saw an email which you're sensing anxiety, as soon as you do that, try to reach out, and at least be mindful of that. Make a list of students that maybe need more attention. Resist groupthink and hive mind mentality. Just because, another maybe faculty member said, they're doing something, or the whole university has an approach, doesn't mean that you have to take that same approach. A lot of times, classroom, I did say that having the classroom have the same things in various weeks or consistency throughout different classes, that helps. However, you don't want to become, just like everything, all of the other classes. You want to have originality. So every type of contact has potential for deep, meaningful connections. What does that mean? And that means, every single email, every single contact maybe that you have, make an effort to connect. In this way, you have more immediacy. Your student may feel that, you genuinely care, and you do. But this allows for this to be established, provide more comfort, and then alleviates anxiety. Connect with students on a personal level, keeping mental health and anxiety in mind. So, carry things beyond the classroom. Sometimes if students need maybe help, even after, if they're reaching out, maybe their professor at that time is not really there for them, and if they need help from you, try to help. It might be something simple. Sometimes students reach out to me that I've had in previous years. They just maybe need a recommendation letter. Maybe they just need some advice. Don't ignore those emails. Be there. Ask students to reflect by writing before, during, and after class. So these reflective pieces. So it might not be just enough to tell them to introduce themselves. Maybe, what are some of your fears in this classroom? Math anxiety is extremely important to assess for before you get started. So, and I do this in my classrooms, kind of assess the readiness for online learning, readiness for the subject matter, and what types of difficulties that the student might be facing. And so some students will say, when as some of my statistics courses, I have never seen, I'm really worried, I might not succeed. So this allows me to provide more tailored guidance in this situation.
This is your 10-minute warning.
Okay, thank you, Michael. Okay, so here's another tool, Mindshift CBT, which I encourage cognitive behavior therapy. I can't say enough good things about this type of therapy. It's employed by, this is something that I used when I was seeing patients, and this is something that can really be effective in addressing anxiety in a strategic manner. Headspace is another good tool. I believe it's $10 per year for students, so it's kind of a nominal fee, and it has a lot of good meditation exercises, a lot of good tools to show that. Okay, so sample strategy used by higher education. What are some of the things? I'm just going to kind of go through this. Educational EAP offers 3 counseling sessions. Now, this is something that's being done at the community college level, which I'm familiar with, and also at the university level. So this is something that's being broadly used. So sometimes, look into your university. Are they using resources, tools? This might be something that is being used or not used. If they are, I encourage you to possibly put in an announcement, in your classroom, class news, class announcement, depending on what LMS you use. Provide this for them. Maybe it's there, but they're not aware. So now this is a decision tree model. I really wish I had a little bit more time to go over this, but it helps you understand which are hypothetical worries and which are actual real problems. So, what am I worrying about? If you're worried, what am I worrying about? Is this a problem I can do something about? Yes. So if it's yes, work out what you could do, list your options. No, let the worry go and focus on something else that is important to you right now. Now, in the yes, is there anything I can do right now? So if you can, then do it, but then no, then you can actually do something called a scheduled worry time, which is in the next slide. So scheduled worry time or worrying delay, delaying the worry period. So, you'll get this slide. I encourage you to go through these steps, do this for yourself. And, this is a simple tool that can be used for your students as well. In many universities, this strategy is posted on their websites. So this is something, if it's not done in your university or educational setting, feel free to introduce it. And so you can kind of select a half hour for worry period. And when you get to that worry period, try to distinguish between those that you have control over and those that you don't. And this is a specific type of cognitive behavior therapy, which has proved to be effective. This was introduced in the 80s, but it has developed further. Okay, so now I'm talking a little bit about suicidal ideation, which is an extremely important part of mental health. And as you can see, about 10% in another survey that I conducted said that this was the case. So extremely important to have these resources available as well, or provide this in the news announcement or somewhere else so that they can have this. Then there's other resources, additional local resources which are available, which you may or may not necessarily list, but also have at your disposal. So that if people do need resources, students may need resources, then you can hand these to them. And that concludes my presentation here. And I will take any questions now in the last 6 minutes remaining. Thank you for listening. So I'm going to pull up the Q&A here so that I can see if there's any questions. Yeah, don't be shy. Feel free to ask any and all questions. I'm actually interested to see, what types of questions you have. Seems like we have a quiet audience. Okay, I think I'm seeing more questions here. Okay. Oh, okay, Cynthia, thanks. Yeah, I always believe in concrete types of actions and suggestions. It's really important to have practical solutions that you can actually do in order to further help your students. Oh, Danielle, right, scheduled worry time. No, I really encourage you to, try this out. And the advantage of cognitive behavior therapy is the fact that a lot of these therapies and strategies that are suggested can be very easily integrated into everyday practice. And it doesn't necessarily require the intervention of a skilled practitioner. It's as long as you know the steps. So about best ways to convey, right, making them comfortable. And that's part of, being there for your students. Immediacy is extremely important for them to know that you're there, you're listening, and that you care. Another aspect of this is unconditional positive regard is another from positive psychology, humanistic, which also has the same sort of philosophy. So yeah, that's some of the skills and strategies to use. Melissa, that is a very good suggestion. So sometimes, maybe at the beginning, starting off with kind of a session like this, and seeing what if you're in a remote environment, they allow them to do this, and this can really alleviate some of that stress. So very, very good idea. Adaptation of what I presented. Thank you. Again, if you have any questions that you think of, feel free to contact me, or if there's anything, any further strategies or anything that you would like to think about, I would be happy to see your ideas. Marie saying, we went through this yet, but are you aware of anyone setting up to study data on how implementation of care strategies impacted retention? Very good follow-up study to this. Yeah, that is a very, very, very good follow-up to trying to figure out, what actually works. I think I haven't seen any evidence about this in the literature, but that's a very good idea. Right, retention carries weight in making change. Absolutely. Couldn't agree more, Marie. Okay, we have one more minute. So, and any other, okay, so there's, I see a couple more questions. One more, do you find institutions of higher learning are planning with the pandemic era in mind, or is there resistance to accepting this, maybe the new norm? Good question. Sherry, the thing is, it's very difficult for, institutions to come up with emergency plans, because we're so busy trying to address, what is going on already, that I think these plans need to be put in place, though. The understanding and the acceptance that we are in an era that requires some convincing for officials. And then the next step, and administrators need to come up with plans to address this. So yeah, very good point, Sherry. And I haven't seen that. So yeah, I hope more and more people do come up and more universities do come up with plans. Okay, final call. I think my time is almost up here. Again, I really appreciate you attending this lecture. I think this is a really good opportunity for not only just me presenting this information, but I really like the dialogue that came out of this, the questions, and I'm seeing that some of these can actually be used in your classroom. So I hope you find this to be effective.
Thank you very much, Dr. Banerjee. We appreciate your support, and thank you for coming to Lancaster Learns to help us all. Thank you, everyone who attended. Great presentations all through the day, and we will be sending out a reminder with the links to the recordings. So thank you very much for participating, and thank you, Dr. Banerjee, for your insights. Have a good day, everyone.
Yeah, have a good day.